Hi everyone and welcome. Medication safety starts with accurate calculations, and that means knowing how to convert between units of measurement. From milliliters to liters, milligrams to grams, and minutes to hours, these conversions are a critical part of your everyday practice. In this video, we'll break down the most common measurement conversions used in medication administration, walk through real-world examples, and give you tips to avoid common errors. By the end, you'll feel more confident, more accurate, and more prepared to ensure safe patient care. Let's take the guesswork out of medication math. Let's start with defining measurements, specifically those used in medication orders. A measurement tells you the quantity of something. You can measure what something weighs. Weight can be in kilograms or pounds. You can measure the temperature of something. Temperature can be measured in Celsius or Fahrenheit. You can measure the volume of a liquid. The volume can be measured in ounces or milliliters. You can measure the mass of a pill or tablet. The mass can be in milligrams, micrograms, or grams. You can measure time. Time can be measured in seconds, minutes, or hours. Measurement conversions are changing a quantity from one unit to an equivalent amount in another unit. For example, converting a patient's weight from pounds to kilograms. You may need to do measurement conversions and dosage calculations when a medication is ordered in a measurement that differs from the one supplied. For example, a medication is ordered as 2 grams, but the tablets supplied are 500 milligrams. You need to convert the 2 grams to milligrams to calculate the correct number of tablets to administer. You change the unit of measurement of grams to the unit of measurement of the tablets supplied, milligrams. You may need to do measurement conversions and dosage calculations when a medication is ordered based on weight, and the weight measurement obtained differs from the one in the medication order. For example, if the patient's weight is recorded in pounds, but the medication order is based on kilograms, you would need to convert the pounds to kilograms. In the order for micrograms per kilogram per minute, you have the patient's weight at 142 pounds. You would need to convert the weight from pounds to kilograms to calculate the number of micrograms to administer per minute. Whenever administering a medication, verify the order to ensure the unit of measurement matches the unit of measurement with the medication supplied. The measurements need to be the same. A key to understanding measurement conversions is that you can multiply any quantity by 1 without changing its value. 1 times 10 is 10, 1 times 50 is 50, 1 times 36.4 is 36.4, 1 times 0.22 is 0.22. Conversion factors are ratios that express how many units of one quantity are equivalent to another unit, and that ratio equals 1. To convert measurement units, you multiply by the conversion factor, which equals 1, to change the unit without changing the quantity. These are common conversion factors used in dosage calculations. 1 kilogram equals 2.2 pounds. 1 hour equals 60 minutes. 1 gram equals 1,000 milligrams. 1 milligram equals 1,000 micrograms. 1 ounce equals 30 milliliters. Each of these conversion factors equals 1. You need to memorize common conversion factors used in dosage calculations. So here are the steps to convert from one unit of measurement to another. The first step is to identify the units you have and the units you need. Then you need to find the correct conversion factor between those units. Then you're going to multiply your original quantity by the conversion fraction so units cancel correctly, and you leave you with the new measurement unit for that medication. Let's try an example. The order is 15 milligrams, but the tablets supplied are 500 micrograms. First, identify the units to be converted. The unit ordered is milligrams. You need to change the milligrams to micrograms because the medication is available in micrograms. The second step is to find the conversion factor between the given units and the desired units and write it as an equation. In this example, 1,000 micrograms equals 1 milligram. This conversion factor equals 1. So you place the conversion factor into a fraction. You put the unit you started with on the bottom and the unit you're converting to on top. This ensures that the given unit cancels out. The third step is to multiply the original measurement as a fraction over 1 by the conversion factor. 1.5 milligrams over 1, you multiply it across by 1,000 micrograms over 1. The milligrams cancel out, leaving micrograms. 1.5 times 1,000 equals 1,500 micrograms. Now you can calculate how many 500 microgram tablets to administer for the dose of 1,500 micrograms. And always check your work. Does the answer make sense? If 1 milligram equals 1,000 micrograms, then 1.5 milligrams must be 15 times 1,000 micrograms. Your answer should be logical and mathematically sound. The unit of measurement for the medication order must match the unit of the tablet supplied. So here's another example. The order reads 4 micrograms per kilogram per minute of an IV drip medication. The patient's weight is 142 pounds. Identify the units you need to convert. You need to convert the patient's weight in pounds to kilograms to complete the dosage calculation. Then you find a conversion factor between the given units of weight and the desired units of kilograms and write it as an equation. The conversion factor between pounds and kilograms is 1 kilogram equals 2.2 pounds. You put the unit you start with on the bottom, pounds, and the unit you're converting to on top, kilograms. Place the original measurement as a fraction over 1, 142 pounds over 1, and multiply it by the conversion factor, 1 kilogram over 2.2 pounds. The pounds cancel out, and then you multiply across. 142 divided by 2.2 equals 64.5 kilograms. This measurement is used to calculate the medication dose. After completing the calculations, always check that your answer makes sense. Check your answer by multiplying back. 64.5 kilograms times 2.2 equals 141.9 pounds. Your conversion is accurate. Example 3. Convert 0.75 liters to milliliters. First, identify the units you have and the units you need. You have liters, but you need milliliters. Then find the correct conversion factor. 1,000 milliliters equals 1 liter. You multiply your original quantity, 0.75 liters over 1, by the conversion fraction, 1,000 milliliters over 1 liter. The liters cancel out. 0.75 times 1,000 equals 750 milliliters. Check your answer by reversing the conversion. 750 divided by 1,000 equals 0.75 liters. Or you can use logic. You know that 1 liter equals 1,000 milliliters, so half a liter equals 500 milliliters, and 0.75 is 3/4 of a liter, so that's 750 milliliters. Example number 4. Convert 1.5 grams to milligrams. First, identify the units you have and the units you need. You have grams, but you need milligrams. Then find the correct conversion factor. 1,000 milligrams equals 1 gram. Multiply your original quantity, 1.5 grams over 1, by the conversion fraction, 1,000 milligrams over 1 gram. 1.5 times 1,000 equals 1,500 milligrams. The grams canceled out. Check your answer by reversing the conversion. 1,500 milligrams divided by 1,000 equals 1.5 grams. Example 5. Convert 90 minutes to hours. First, identify the units you have and the units you need. You have minutes, but you need hours. Then find the correct conversion factor. 1 hour equals 60 minutes. Multiply your original quantity, 90 minutes over 1, by the conversion fraction, 1 hour over 60 minutes. 90 divided by 60 equals 1.5 hours. The minutes canceled out. Check your answer by reversing the conversion. 1.5 hours times 60 minutes per hour equals 90 minutes. Example 6. A patient weighs 166 pounds. What is the weight in kilograms? First, identify the units you have and the units you need. You have pounds, but you need kilograms. Then, find the correct conversion factor. 1 kilogram equals 2.2 pounds. Multiply your original quantity, 166 pounds over 1, by the conversion fraction, 1 kilogram over 2.2 pounds. The pounds will cancel out. 166 divided by 2.2 equals 75.5 kilograms. Check your answer by reversing the conversion. 75.5 kilograms times 2.2 pounds over kilograms equals 166.1 pounds. And one final example. A medication is prescribed at a dose of 1.2 grams. How many milligrams is this? First, identify the units you have and the units you need. You have grams, but you need milligrams. Then, find the correct conversion factor. 1,000 milligrams equals 1 gram. Multiply your original quantity, 1.2 grams over 1, by the conversion fraction, 1,000 milligrams over 1 gram. The grams cancel out. 1.2 times 1,000 equals 1,200 milligrams. Check your answer by reversing the conversion. 1,200 divided by 1,000 equals 1.2 grams. There are online conversion calculators used for quick conversions. Ensure first that you understand what you're converting. Make sure that the calculator is a reputable source, and ensure that you have placed the measurements in the correct locations on the calculator. Always make sure that your answer makes sense, and use the calculator as a tool, not a substitute for critical thinking. Accurate unit conversions are critical when calculating medication dosages. A small error can have serious consequences for patient safety. Knowing how to avoid common mistakes is essential. Here are some tips to help you stay sharp and ensure safe and accurate medication administration every time. Always double-check units. Make sure you're working with the correct units. Convert units if needed before you start calculations. Know key conversion factors by heart. Memorize common conversions. 1 gram equals 1,000 milligrams. 1 milligram equals 1,000 micrograms. 1 liter equals 1,000 milliliters. 60 minutes equal an hour. Having these at your fingertips prevents small but dangerous mistakes. Watch decimal points carefully. Decimal point errors can lead to 10-time overdoses or underdoses. For example, 0.1 milligram is not the same as 1 milligram. Always check. Use a leading zero and never a trailing zero. Clarify orders if unclear. If a dose or unit in a medication order seems off, don't guess, ask. It's always better to double check than risk a serious error. Use a calculator and cross-check. Use a medical calculator or app when possible. Have a colleague verify your calculation when in doubt, especially with high alert meds like insulin or heparin. Understand the medication. Know how the drug is supplied and administered. This helps you spot when something doesn't make sense. And practice, practice, practice. Do regular practice problems to keep your math skills sharp. The more you practice, the quicker and more confident you'll become. Thanks for watching. If this video was helpful, give it a like, share it with your classmates or coworkers, and subscribe for more nursing education content. You can find more videos at nursevideohub.com. Watch, learn, and care.